everyone. My name is Amelia Williams, and I'm a representative from the Young Adult Program of the Every Life Foundation, and I'm here to speak to you today on young adult rare disease advocacy, specifically in the United States. So today we're going to start by talking about rare disease and my story with that before moving into the impact of rare disease, really why this issue matters in the United States, how we can sort of affect change in this issue through the power of patient advocacy. Then we'll talk a little bit on my advocacy journey so you can see what advocacy really looks like, and then how you can get involved yourself. To start, who am I and why am I the one speaking to you today? So I'm a junior at Purdue University, so in my third year of university, studying public health in West Lafayette, Indiana in the United States. I'm also a young adult representative of the Rare Disease Legislative Advocates, or YAR as I'll later refer to this, and that's through the Every Life Foundation. I'm the co-founder of the Vanderbilt Alliance on Disability and Condition, and a researcher in the Violence Prevention Research Coalition. Each of these things we'll talk a little bit more about what that means later, but each of them are a way that I use advocacy in my day-to-day life. Advocacy for me is not just a one-off thing. I don't do it one day, give a speech, and then stop until the next speech. It's a lifestyle for me. So every day when I'm with friends, my friends know about my story, and I share with them the problems, the struggles, the successes that I have. And I share with my school through my organization, through other things there. I play sports, but my sports teams knows about my conditions, and I use each of these platforms through friends, family, even baking and other art projects as part of my life of advocacy. My rare disease connections are that I live with Ehlers-Danlos syndrome, a connective tissue disorder that affects all my body systems. And as a comorbidity, or a disease that goes along with this, is gastroparesis, where my stomach and digestive tract is paralyzed, which makes it hard for me to process food. And then I have idiopathic hypersomnia, which is where my brain at its natural condition is actually asleep. And so I need medication in order to wake me up and so that I can function normally. I also have rare disease connections through my family. My twin sister, as you can see here on the slide, has Guillain-Barré syndrome, where her immune system fights her nerves, causing them to break down progressively, and arteriovascular malformation, where she has a venous tumor, so a tumor full of veins on her left hand. Before going into a little bit more of my personal story, it's important that you understand why it really matters that we talk about rare disease and we advocate for people that have rare diseases. So in the United States, a disease is considered rare when it affects fewer than 200,000 people. While this may seem like a small number, and you may ask the question, why should we really care about these when there are conditions that affect many more people? It's important to think on a larger scale. In the United States, there are more than 7,000 rare diseases, and in total, these rare diseases affect an estimated 30 million Americans. So even though there are only 200,000 people with each rare disease, in total, it affects a lot more. In each of these conditions, 93% have no FDA-approved treatment, meaning that the people who live with them don't have treatments that can improve their quality of life and fix their diseases. This means they're stuck living without treatment and having to go about their day-to-day life in a way that doesn't allow them normal living conditions. There also is an economic burden that comes along with this. As many of you know, rare diseases cause a lot of costs for your family. And in 2019, there was a study done called the National Economic Burden of Rare Disease Study that calculated the total economic burden, so the total monetary burden of rare diseases across the United States in 2019. And although it only calculated this for about half of rare disease patients, 15.5 of the approximately 30 million patients, it totaled the sum of costs to be $966 billion in the United States. That is a large sum of money that is composed of direct medical costs. So this is kind of what we naturally think of when we think of medical costs. So this is hospital stays, doctor doctor's appointments and medicine. There's also indirect costs or productivity loss, which is presenteeism. So when someone's at their work, but their symptoms like their pain or their fatigue cause them not to do as good a job as they could otherwise do. Absenteeism, where they just can't show up to work some days because of their symptoms of their diseases. And early retirement. And then there's the non-medical and uncovered medical costs. And these are the things that are tended to be overlooked, but are actually really important costs. So some of these are home modifications. So in my house, we have installed bars along the hallway so that we can, those of us living with rare diseases who have trouble with mobility can have stable balance as we walk down the hall. Or we also have higher toilet seats so that we can balance getting up and down from the toilet. There other things in this category are auto modifications. So some people have to have larger dashboard print, uncovered healthcare costs, and transportation costs to medical appointments and other added transportation. So all in all, I'll reiterate, this costs the United States $966 billion in 2019, which is a very large burden. But the burden of rare disease doesn't stop there. There's a lot of personal impact on friends, families, and the individual themselves living with the rare disease. And here I'll talk a little bit about how this looks like in my life. But as you guys know, there's a lot of personal impact on everyone's life, and that looks a little different for everyone. First, there's like the emotional roller coaster of living with rare disease. There's a lot of unknown, a lot of fear. When you don't have treatments, as 93% of rare disease don't, you live on the edge of not knowing what comes next, not knowing how the progression of your disease can result. I know there's been times that my family and I have looked over the edge and seen the possibility of death with no control over what comes next. And that brings a lot of tension, anxiety for all the people around you. So that's one personal impact. There's also the personal impact of just time spent in the hospital and at doctor's appointments. I know my little siblings have to endure a lot of time with only one parent around because the other parent is taking me or my sister to the doctor or to faraway hospitals for treatment. And then there's just the day-to-day impact of being surrounded by medical stuff. My little sister, for instance, when she learned to talk, one of her initial words was feeding tube. She understood the language and the impacts of feeding tubes because of my own feeding tube before she understood some other concepts of the world, just because that's what she was surrounded by. So there's a lot of personal impacts that come with rare disease, more than I can even mention, but each and every person living with rare disease affects themselves, their own lives, as well as the people around them's lives, which means the burden of rare disease extends much beyond the 30 million people that we talked about earlier. But there are things that we can do about this problem, and that's where patient advocacy comes in. The kind of advocacy that I'm talking about here is grassroots legislative advocacy. This is where an individual person goes to their legislator and asks for legislative change. And by lots of people doing that and asking for similar legislative changes to their Congress member, then in total, this is a large group that convinces their Congress member to make change. And yes, each individual person has the power to make change when they take an active role in the political process, because policymakers have the ability to impact science, drug development, drug discovery, and access to treatments through policy. And when their constituents or the people they represent ask them for something, they know that it's important to them, and thus they will follow through in making change. Your legislators actively want to hear from you because you are the person they represent, and you are the one with the story that is powerful because you know how it's like to live your life. And one example that I think you might be able to relate to is, have you ever heard a story that you just can't get out of your mind, or seen a picture of somebody going through something and just had that stuck in your mind and just really you wanted to do something about it? That's the same thing you can do with your legislators. When you go in there and you tell your story, It might be that your story is the one they just can't quite get out of their mind. And they're like, I want to do something about this. I want to help this kid on a ventilator, or I want to help this person have a better quality of life or access treatments. And that's really where your rare disease advocacy comes in. Relationships really do matter here. The more you can talk to your representatives, have in-person visits, or contact them via phone or letter, it has a lot of positive influence on their voting decisions. So this graph is just a graph that shows you the more in-person and personal visits that you have, and the more you form that connection with your legislator, the more power your voice has in the political process. And as many of you probably use social media, it's also a great tool for your advocacy. You can use it first for just making people around you and your legislators aware of what you go through on the daily life, but you can also make it known to them that you are paying attention and forming relationships with them. You can thank them for actions that they do take to support your rare disease and its treatment. You can thank them for meeting you and tag members in your photos to really make them aware of the problems that you face. On the left here, you can see one of the posts that I made after meeting with my legislator. And I talked a little bit about the power of the meeting for me personally, drawing in both an audience of the legislator and his team itself, as well as other people who might be drawn into advocacy from my work. That leads a little bit into my advocacy journey. My advocacy journey actually started in silence. A lot of you may be thinking, this is all well and good, but I could never do that. I don't know where to start. I have no power. I don't like public speaking. Well, my journey started in literal silence. My junior year of high school, I barely said a word. It's called selective mutism, and it came for me personally from a history of trauma. I literally was silent, yet I am still an advocate today. These are the advocates that led me to advocacy. These are my adoptive mom and dad, and they had the power to change my story by reminding me that I had a voice. And so how do I use my voice today? There's a lot of different ways that you can do advocacy. One is artistic advocacy. You can express your emotions and what it feels like to live with your rare disease through art and writing, and you can publish those things. There's actually a rare disease art contest called Rare Artists that you can submit to, as well as many other platforms that you can share your art with others, including with your representatives, to say, this is what I'm feeling, this is what I'm going through. And that's one thing that I like to do. Daily life advocacy has become really important to me because it has the power to make others around me aware of what I go through and encourage them to use their voice to support me as well. I at first was very hesitant to do this because it is a personal story of mine that I am sharing, but bravery has the benefit that it really encourages others to be a part of legislative advocacy and use your story and their story together for good to make change. Next, I have organizational advocacy. I started with another founder, the Vanderbilt Alliance on Disability and Condition on Vanderbilt campus. This is an organization for students there to get involved in advocacy about their disease and condition, as well as disability in general. This is one way. It may not be the easiest way to get involved in advocacy, but this is definitely a very good way to get others involved in advocacy as well as yourself and have a leadership role in that. Then we have YAR, the Young Adult Representative of RDLA, and Rare Disease Week and other advocacy through this, which I'm going to touch on in a minute, how you can actually get involved in what the program entails. But before I do that, let me be the advocate that leads you to advocacy. This is your story and you have the power to make change. So let me tell you how you can, how to get involved. The next steps in your advocacy journey is to meet with your legislators and join a young adult group based on advocacy. And so the three things I'm going to focus on here, although iCAN and other programs have ways for you to get involved in advocacy as well. The three things I'm going to touch on are YAR, Rare Across America and Rare Disease Week on Capitol Hill. Rare Across America is a pair of weeks in which the Every Life Foundation coordinates teams of people to go talk to their representatives based on their interests about issues pertaining to rare disease. This occurs when Congress is in recess, so all the representatives are back in their home state. So you can actually go and talk to them about issues that matter to you while they are in your home state and you don't have to travel as far. If you want more information about this, rareacrossamerica.org is a good place to find it. And this actually happens in August of this year. So if you're interested in doing this, it's a great time to sign up. Rare Disease Week on Capitol Hill is a second awesome opportunity for advocacy in which you get to meet your legislators and form that relationship with them. This one happens in spring, and it happens while Congress is actually in session. So everyone is in Washington, D.C. for the most part, and you travel to Capitol Hill and you again form that relationship with them to talk to them about policy. There's also a lot of education sessions along with Rare Disease Week where you can learn about policy, learn how your voice matters, and really get involved with other young adults and other advocates who are doing this as well. For more information on that, you can go to rareadvocates.org/RDW. Then there's YAR. I'll once more spell out this acronym. It's Young Adult Representatives of Rare Disease Legislative Advocates, or RDLA. And it's a group of 16 to 30-year-olds who are highly motivated to represent the rare disease community. And these are people who either live with rare disease, are friends or family of people with rare disease, or who are just really passionate about rare disease advocacy. And this program is meant to instill confidence and the ability to really advocate for the issues that matter to you. And through it, there are three main programs. The first opportunity that YAR provides you is the Speakers Bureau. This is focused on public speaking and allows you to be prepared for opportunities like this one to speak to other young adults and other people about rare disease advocacy and also about rare disease policy and other things that matter in the rare disease space. The second one is the Rare Disease Leadership Academy, which focuses on policy and drug development to really give you a well-versed vocabulary in the processes behind legislation in the rare disease space. And finally, we have the YAR Summer Series, which is the series of webinars on issues important to the YAR group, which they decide on together. And then on top of these three major opportunities, we have general assemblies once a month where we get together, talk about issues in the community, talk about opportunities like scholarships or places you can advocate, and then really celebrate each other's accomplishments. If you want to follow along for more information on YAR, you can go to our Instagram page at HearUsYAR or our LinkedIn page at HearUsYAR. And then we also have a Facebook page, but in the interest of really forming a community there, that's for members only. So once you sign up, you'll have access to that. For any more questions, you can email Lindsay, who is the director of the program, and her email is listed there at the bottom of the screen. Again, let me be the advocate that leads you to advocacy. If you have any questions for me at all, here's my contact information, and I'd be more than happy to walk you through what it means to be an advocate or help you get started in your journey at any point that you want to. My contact information is listed here. Feel free to use it. And thank you for listening to me speak today.